Nigerian officials say the confirmed case is an Italian national who works in Nigeria and returned to Lagos from Milan, Italy, earlier this week. He is now being treated in a Lagos hospital and is said to have no serious symptoms. Across Africa, authorities are stepping up surveillance at transport hubs. Single cases of coronavirus have been detected in Egypt and Algeria. The World Health Organization warned Thursday that no country can assume it is safe from the virus.
This virus does not respect borders. It does not distinguish between races or ethnicities. It has no regard for a country's GDP or level of development. The point is not only to prevent cases arriving on your shores. The point is what you do when you have cases.
Until this month, Senegal's Pasteur Institute was one of only 2 African research laboratories able to test for the virus.
If it is detected sooner, that will be more effective in limiting its spread.
The apparent delay in any African outbreak has given the continent time to prepare. The World Health Organization says more than half of sub-Saharan countries are now equipped with laboratories that can test for the virus.
It's not as extensive as we need it to be, and the testing that's going on in countries isn't as complete as we'd like it to be, but the fact that we've been able to stand this up in relatively short amounts of time, I think represents progress.
It's feared that an undetected outbreak could rapidly escalate into a health crisis. Around 80% of people with coronavirus have only mild symptoms, meaning the true prevalence is likely underreported. Most fatalities have occurred in those with underlying health problems. But a pandemic in Africa would overwhelm medical facilities.
It's an issue when it comes to managing other medical problems. So that means that people with heart disease and things aren't necessarily able to visit the hospital or to get an appointment. And subsequently, we could see increased mortality from other medical problems simply because they can't access the health system.
Experts say many African nations must improve disease surveillance and operations to trace the spread of infection. They also warn that in the event of a global pandemic, the international community must be ready to step in and help countries with weaker health systems. Henry Ridgwell for VOA News, London.